Hello, my name is Georgia Smith and welcome to today's short presentation on the importance of chloride ions in the central nervous system and skeletal and smooth muscle. So let's dive right in. The first topic I'm going to be going over is GABA and its physiological effect as well as how it affects the neuronal excitability in the central nervous system. In the central nervous system, which consists of the brain and spinal cord, GABA, short for gamma-aminobutyric acid, acts as an inhibitor of nerve transmission in the brain. It is one of the major inhibitory neurotransmitters as it is an amino acid and acts as a neurotransmitter, reducing the activity of the neurons that it binds to. So, how does GABA exactly work? GABA is made in the brain from glutamate, an excitatory neurotransmitter that binds to cells, encouraging them to fire. As GABA is an inhibitory neurotransmitter, it is made to do the opposite and block nerve impulses, thus creating a sensation of calming in the brain. Without the use of GABA in the central nervous system, glutamate would excite nerve cells too often and frequently, and without GABA to block those nerve impulses, it can often result in disorders such as anxiety and panic attacks. Next, I'm going to be chatting about benzodiazepines in the central nervous system. Benzodiazepines, such as Valium, are often prescribed to patients with generalized anxiety, panic disorder, and OCD to reduce neuronal excitability. They work as a central nervous system sedative to increase the response of the mechanism GABA and enhance its function in reducing neuronal excitability. They do this by increasing the neuronal chloride ion influx, resulting in hyperpolarized postsynaptic membranes, enhancing the central nervous system's sedative response to GABA. Another substance that works as a similar sedative is alcohol, and when combined with Valium, the two sedatives continue to reduce neuronal excitability and greatly relax muscles, bringing the central nervous system to a crawl. By combining these two sedatives, it is increasing the risk of unconsciousness, coma, and even accidental suicide, as it can lead to organ failure during the relaxation of muscles. Chloride ions also play a role in skeletal muscle, and it's quite important. The CLC1 channel is responsible for the chloride movement in skeletal muscle. It has a very important role in skeletal muscle, as it is in charge of membrane repolarization after a muscular contraction. The CLC1 ion channels account for 80% of the membrane conductance. This high conductance level enables the CLC1 to conduct a membrane current to inhibit muscle excitability. This inhibitor is important in prolonged activity as it preserves excitability in a working muscle. Finally, I'm going to be discussing what channelopathies are and their effect on the ion channel function. So, channelopathies are pathological conditions that affect the ion channel function. One of the main channelopathies that affect the conductance or the conduction of chloride in skeletal muscle is myotonia congenita. It is known to be the most common skeletal muscle channelopathy in humans. It is a symptom of a condition that impairs the relaxation phase of a skeletal muscular contraction. The sarcolemma are the sheaths that wrap the fibers of skeletal muscle, and myotonia is caused by a reduced sarcolemma chloride conductance due to mutations in the CLC1 channel that we previously discussed in the slide beforehand. That concludes this short presentation on the importance of chloride ions in the central nervous system, skeletal, and smooth muscle. I hope you enjoyed this presentation.